Again, welcome to the Non-Communicable Diseases Capacity Assessment and Planning Process, or NCAP, launch. For today's agenda, we will start with a welcome from Dr. Carl Reddy of TEPHINET, followed by Dr. Patricia Richter of the CDC. Then Dr. Yosef of EMPHNET will introduce the NCAP process, and Dr. Sawed will share experiences of implementing in the Eastern Mediterranean region. This will be followed by an introduction to the NCAP process facilitator and recorder e-learning training, and a live demonstration on how to access the materials and e-learning course. We will end our session with 10 minutes for questions and discussion. To get us started, I would like to introduce Dr. Carl Reddy, the Director of the Training Programs in Epidemiology and Public Health Interventions Network, or TEPHINET. Over to you, Dr. Reddy. Oh, sorry, Dr. Reddy, it seems like you're still on mute.
Thank you. Okay, good morning, everybody. I'm Carl Reddy, Director of TEPHINET, and it is my pleasure to welcome you to our launch of the Non-Communicable Diseases Capacity Assessment and Planning Process, or NCAP. Non-communicable diseases, or NCDs, such as cardiovascular diseases, cancers, chronic respiratory diseases, and diabetes, are the leading cause of death and disability globally. Each year, 41 million people die from NCDs. That is 7 out of 10 deaths worldwide. NCDs disproportionately affect the poorest and most vulnerable populations, with premature deaths almost 6 times higher in low and middle income countries. 85% of premature NCD deaths, those occurring before the age of 70, take place in low and middle income countries. NCDs lead to high healthcare costs, productivity losses, the need for expensive long-term care, and strained economies. In 2015, world leaders committed to meeting the United Nations Sustainable Development Goal Target 3.4 to reduce premature mortality from NCDs by 1/3 by 2030. However, to date, few countries are on track to meet this target, and without immediate action, many will fall short. New approaches and tools are needed to help countries develop and strengthen their responses to better address NCDs. That is why we are excited to collaborate with the CDC to share the NCD Capacity Assessment and Planning, or NCAP, process with our network of experts and host the materials and e-learning on our TEPHINET website. With this CDC and TEPHINET collaboration, we hope to increase access to and use of the NCAP process to support countries interested in improving the ways they address NCDs. Thank you.
Thank you, Dr. Reddy, for your words and collaboration on this project. Next, I would like to welcome Dr. Patricia Richter of the CDC.
Greetings, everyone. I'm Dr. Patricia Richter, Chief of the Office of Global Non-Communicable Diseases at the U.S. Centers for Disease Control and Prevention. As Dr. Reddy described, the burden of NCDs is an increasing public health threat for countries around the world. We developed the NCAP process in response to the growing need for tools to address NCDs and as a specific interest by the Eastern Mediterranean region. The NCAP process is a facilitator-led tool that can be used by ministries of health and other key government and non-governmental stakeholders to assess, prioritize, and plan how to improve the national capacity to address NCDs and population health. It's designed to engage multi-stakeholder dialogues to align NCD efforts and promote collaboration to achieve more sustainable and impactful progress. It is not intended to address specific diseases, but rather to look at collective efforts and capacity to address NCDs with outputs that can inform national efforts to function more effectively. Leadership by the Ministry of Health is essential for successful conduct of the activities and implementation of the outcomes. They are engaged from the beginning and provide direct input on all activities. In order to successfully implement the NCAP process, facilitators and recorders must be trained on NCAP process procedures and facilitation best practices. Similarly, public health networks can be trained to learn more about the NCAP process and promote the tool within their countries or regions. During development of the NCAP process, the CDC, EMPHNET, and EMPHNET led these trainings virtually. However, we knew this format was not sustainable. We wanted to increase the accessibility of the NCAP process so that any country around the world could be properly trained to use the tool effectively. That is why we created the NCAP Process Facilitator and Recorder training course. Today, we will present in more detail about the NCAP process tool and the e-learning course we have developed to encourage participants to share with their networks or to train and use the tools in their respective countries. Finally, we would like to acknowledge the partners who have contributed to the development of the NCAP process and the e-learning training course. We began this work in 2021 and are grateful for the collaboration with the International Association of National Public Health Institutes, the Global Health Development Eastern Mediterranean Public Health Network, or EMPHNET, TEPHINET, and our colleagues on the NPHI team in the Division of Global Health Protection.
Thank you, Dr. Richter, for this great summary. I echo your appreciation for all our partners involved in this process. Next, I would like to introduce Dr. Yosef with EMPHNET to describe the NCAP process in more detail.
Thank you. Good day, everyone. I am Yosef Khadr, the Director of the Center of Excellence for Applied Epidemiology at EMPHNET. Collaborating on the development of the NCAP process has been a pleasure, as it is a unique tool that is able to help countries define their NCD stakeholders, prioritize what's critical to them as a nation, and delve deep into this critical NCD area, whereby they themselves are able to analyze and evaluate it and come up with their own specific, multi-sectoral, and tailored plan of next steps. NCAP process is composed of instructor-led activities. The first activity is stakeholder mapping, which aims to identify key NCD technical and policy stakeholders. This is followed by strengths, weaknesses, opportunities, and the threats, SWOT workshop, which usually it is one-day workshop, aims to understand the NCD landscape in the country and identify critical NCD areas. The last activity is NCAP workshop. Usually it's 2 or 3 days workshop to assess the country's current level of progress in a critical NCD area, determine the country's preferred level, and prioritize and plan the steps needed to reach the preferred level. The expected outcomes of this NCAP process, each activity concludes with a summary report. For example, the stakeholder mapping report or summary report is usually inform the selection of participants for the SWOT workshop and NCAP workshop, while the SWOT summary report aims to summarize the discussion of critical NCD areas. And of course, the findings from this report inform the selection of discussion guide. And then the final outcome, and this is actually informed the NCAP process report, which summarize the entire NCAP process. So in the final NCAP process report, it provides an over summary of all activities, outputs, and outcomes, and assess the country to develop their integrated multi-sectoral national NCD strategy, policy, or action plan, or country-specific technical plan to tackle NCD areas in NCD in prevention and control. Multiple persons are involved in the NCAP process. As Patricia mentioned, the leadership of the Ministry of Health is essential, and they should be involved from the beginning of the NCAP process to provide direct input to participants, activities, and decisions. For public health networks like EMPHNET, TEPHINET, or National Public Health Institute, usually promote the use of NCAP process and serve as a resource to countries who are interested and ready to implement NCAP. The participants, usually their selection is based on stakeholder mapping, but usually it includes leadership staff from different NCD governmental and non-governmental organizations who can contribute their expertise and resources. As we mentioned, that NCAP process is instructor or facilitated led process. So trained facilitators work with the Ministry of Health to tailor activities, conduct stakeholder mapping, lead the SWOT workshop, design and run the NCAP workshop. And of course, this process also involves trained recorders, one or two, who usually document discussions from the workshops. It is an optional to have a trained external evaluator who can observe the whole process and provide feedback to facilitators. Different materials actually developed and available, and different resources, standard operating procedures are available, and documents and materials are also supporting materials are available. But the most important one that guide the whole process is the discussion guide. What's discussion guide? Discussion guides are tools used by facilitators to lead customized and in-depth conversations during the NCAP workshop. Discussion guides have themselves relevant to common issues faced in strengthening NCD efforts. There are several discussion guides that have been developed and has been implemented. Some of them have been implemented in some countries, like coalitions, multi-sectoral action, evidence-informed action, strategic data collection and analysis, and surveillance. This is an example of discussion guide. I don't expect you to read everything in this table or in this guide, but usually discussion guides showcase the different levels of development of the country with respect to the identified NCD area. This is in fact based on the concept of maturity models to define distinct and increasingly more progressive levels of development for 6 public health domains within the critical NCD area. Strategic direction, it's one domain. Are priorities clear and strategic? Systems, are resources and tools available or in a place to support the process? Resources, are human and material resources available and adequate? Quality, is the quality measured and are standards met? Engagement is another domain. Are stakeholders engaged? And lastly, the impact domain. So these domains are broad categories that should be considered when assessing the level of progress and developing the plan for addressing NCDs. These help to organize the discussion and ensure that a range of important issues are considered. Thank you.
Thank you, Dr. Yosef, for this helpful overview of the NCAP process. Next, I would like to introduce Dr. Saad, who will share EMPHNET's experiences implementing the NCAP process.
Thank you, Sonia, and hello, everyone. I'm Randa Saad, a technical specialist with EMPHNET. So our first experience with the NCAP process was in Jordan in 2021, when we, along with the Royal Health Awareness Society, which is a local partner in Jordan, were trained by the CDC and EMPHNET to facilitate the NCAP process. We implemented the process in collaboration with the Jordanian Ministry of Health and with participation from the World Health Organization and other key NCD stakeholders in Jordan. Now, in Jordan, the NCAP process focused on the data to action continuum and really assessed how the country collects and analyzes NCD data and synthesizes information to inform programs and policies relating to NCDs. These are some pictures from the activities in Jordan, and as you can tell, COVID regulations were in place in 2021. Now, the results of the workshops in Jordan were published by EMPHNET as a policy brief in December 2021, and the brief focused on the need for a national NCD strategy in the country that addresses data priorities, including a health information system for NCD data collection. Now, the workshop outcomes later informed aspects of the Ministry of Health's roadmap for strengthening primary care in Jordan and the Ministry of Health's NCD strategy and action plan, which are currently being developed. Now, piloting the NCAP process in Jordan demonstrated the need to develop NCAP process implementation material. Dr. Yusuf went over them briefly, but these, we needed SOPs, additional discussion guides that align with critical NCD areas. And the process also, the pilot highlighted how important it is, and Patricia mentioned it, and Dr. Yusuf mentioned it, how important it is to engage ministries of health from the beginning of the activities to simply ensure country ownership of the results and the process's success. Now, later in 2022, we, and by we, I mean EMPHNET, began conversations with the Iraqi Ministry of Health as a potential country to implement the NCAP process. Now, Iraq was identified due to their interest in non-communicable diseases and their highly motivated NCD department, which was very eager to implement the NCAP process. We, EMPHNET, we identified a local consultant with experience in leading and facilitating high-level meetings, and we supported her training and provided her with technical assistance throughout the process under the guidance of the Iraqi Ministry of Health and in collaboration with the CDC and EMPHNET. Now, through the SWAT workshop in Iraq, a strengthening an existing NCD coalition was determined to be of importance. And as a result, the NCAP workshop brought the coalition members together and addressed coalition strengthening with the members. And they came up with a plan of how to strengthen their coalition. These are some pictures from the SWAT and the NCAP workshop in Iraq. This is our wonderful facilitator there. Yes, Dr. Bushra. Now, the Iraq plan of next steps addressed communication strategies between the coalition members, tackled the issue of finding new resources of funding to implement activities, and focused on action points to update, activate, and review laws and legislation related to issues that they themselves thought were important to the country, which were mainly healthy diet and physical activity. Now, the process in Iraq also received some media attention, and actually a story was published in a local news magazine to highlight the activities, the stakeholders that were involved, and the outcomes of the process in Iraq. The success of the ENCAP process in Jordan and Iraq garnered interest from other countries in the Eastern Mediterranean region, including Pakistan, specifically the Azad, Jammu, and Kashmir region. Now, stakeholders in the Azad, Jammu, and Kashmir identified NCD surveillance as a critical NCD area during their SWOT workshop. And accordingly, the ENCAP workshop, which was very recently completed, focused on NCD surveillance. Stakeholders during the workshop were able to put a plan in place and identify roles and responsibilities of each of the parties that were involved to mainly tackle the development of an NCD surveillance strategy and resource reallocation measures, the integration of NCD in available disease surveillance structures, the need for and the plan of how to build the capacities of the health staff and sensitize them on NCD surveillance, and how to develop a feedback mechanism between referral hospitals and primary health care, and create a mechanism for NCD data monitoring and quality assurance. And these are our stakeholders who were involved in the ENCAP process in Pakistan. Thank you very much.
Thank you, Dr. Syed, for this great description of how the Eastern Mediterranean has used the ENCAP process to strengthen the region's capacity to address NCDs. Next, I would like to introduce Meredith Cruzy, who will present the ENCAP process facilitator and recorder training course.
Good morning. Thank you, Sonia, and thank you for all my colleagues for joining us this morning. My name is Meredith Cruzy. I am a contractor with the Office of Global Non-Communicable Diseases here at the U.S. Centers for Disease Control and Prevention. So as my colleagues previously described, the ENCAP process includes 3 facilitator-led activities. In order to implement the ENCAP process successfully, facilitators and recorders must be trained on the ENCAP process materials, procedures, and general facilitator and recorder best practices. In Jordan, Pakistan, and Iraq, the CDC, EMPHNET, and EMPHNET led virtual trainings for the facilitators and recorders. And in 2023, we collaborated with TEPHINET to adapt these previous training materials to develop a self-led e-learning training course that incorporates e-learning best practices. The non-communicable disease capacity assessment and planning process facilitator and recorder training content is derived from the ENCAP SOPs that Dr. Yosef described, and also includes examples from the countries to illustrate key concepts. Knowledge checks and interactive practice exercises are included throughout all modules to allow learners to self-check their comprehension and ability to perform tasks essential to the ENCAP process. So here you can see the training objectives for the course. So the course includes approximately 6 hours of content and is structured into 6 different modules. Module 1, Introduction and Preparation, provides a general overview of the ENCAP process and describes specific preparation steps that take place when ministries of health are deciding to use the ENCAP process in their countries. Module 2, Facilitating the ENCAP process, covers how to lead the activities, including necessary materials, logistics, and best practices for facilitating and recording. Module 3, Stakeholder Mapping, details the first activity of the ENCAP process, which is stakeholder mapping, and the procedures. Module 4, the SWOT Workshop, details the second activity of the ENCAP process, which is the SWOT Workshop and the procedures. Module 5, the NCAP workshop, details the third activity of the NCAP process, which is the NCAP workshop and procedures, as well as the NCAP process follow-up that takes place after all activities have concluded. And then finally, we have the Module 6, simulation of the NCAP process. And this module presents real-life situations and asks learners to apply what has been learned and explore a simulation of the NCAP process. The NCAP process facilitator and recording training is now available on the TEPHINET website for all of those interested in taking the training and implementing the NCAP process in their country.
Thank you, Meredith, for this overview of the new e-learning training course. Next, I would like to introduce Stephen Kim, with TEPHINET, who will show us where to access these new materials. And I'm going to stop sharing my screen and turn it over to you, Stephen.
Thank you, Sonia. Can everyone see my screen?
Yes.
Yes. Okay, hello, my name is Stephen Kim. I'm the project manager here at TEPHINET, and it's my pleasure to demonstrate how to access the NCAP landing page and e-learnings. So just to begin, I'll start with our TEPHINET homepage. Our homepage is www.tephinet.org. And when you get to our landing page, from our main menu, you have to hover over to the Learning Center, and there'll be a TEPHINET library. And in that TEPHINET library, there are a variety of materials, learnings that are available publicly with our community. And as you can see, the NCAP process is at the very top, and these materials will gradually move down as more content and material are available. At this case, it'll be very useful to use the search function as well as a filter function to apply to a specific resource you may be looking for. Now, for the purposes of our call, we'll go navigate to the NCAP process first, and we'll take a look at what's available on this page. As Dr. Yusuf has described about the NCAP process tools, there are a variety of materials that are available to the different Ministry of Health and Public Health organization partners. So this page describes the purpose of the NCAP process, the specific stakeholder mapping, the workshops, the SWOT workshop and NCAP workshop that happens as part of the NCAP process. And the materials available are listed below, such as the standard operating procedures, the NCAP activity report templates, the workshop form, the summary of the NCAP process, as well as the general background description presentation that's helpful for all the stakeholders, as well as the important discussion guides that go along with each NCAP workshops. To download the material, we have a sidebar where it demonstrates the folder, the material that's available in a zip format. So all these content can be available as downloads, and once it's downloaded, it has to be extracted and unzipped to be able to view all the content that's there. But those are available on our website in the sidebar. And nextly, to navigate to our e-learnings, you can either go through this page to navigate to our supplemental page that has all the e-learning, facilitator, and recording trainings, or again, going back to the Learning Center in our TEPHINET library to get to our NCAP process facilitator and recorder training course. As Meredith has described a little bit, the objectives and each module and what it contains, I'll briefly access two examples of the module to demonstrate what interactive pieces are there for learners, as well as some of the design that went into developing this e-learnings. So this is how the course would generally look like, and you can start module by clicking on the button there. So as you mentioned, there are a variety of interactive pieces in our e-learning design, and these are self-guided, and learners can come to this module at any time The progress won't be saved, but it allows the users or the learners flexibility to take the modules at a time that's convenient to them at any time of the day that they desire to do so. So some of the interactive pieces, we have resource downloads. We have a section that expands to provide more details about each content that's described here. We also have some videos shared gladly by the EMPHNET colleagues. So you'll be able to see a short video clip that describes the process here, as well as knowledge checks and quizzes at the end of each module to make sure that all the learners that's taking this course are familiar with the concept that are used as well as the process. Next, there's 6 modules as we described. The last module, it's a simulation of the NCAP process, and so the software we've used for the e-learning is a little bit different. So I'm happy to go over briefly the interactive that's taking place in module 6. So as a simulation, the layout is very similar. However, when you get to each simulation section, these are slides that are consecutive. Please allow for it to load. So as you can see, these are slides that you'll be able to go through each process as if you're making decisions with partners. And there are various methods or options for you to choose from. There's correct and wrong answers. And as you navigate, you'll be able to see what are the correct answers so that you can simulate your NCAP process. And this slide continues until your slides prompts you to continue to the next slide. So please continue to the simulations. Sometimes the simulation is loading slower, so please be patient with each slide as to ensure that all you're navigating each pages before moving to continue to the next set of simulations that's available for each major steps of NCAP process and so forth. So after you're done with each modules, you can return to the landing page by returning home or simply exiting out of your existing module and going to the landing page where you've originally started from, which is the e-learning page. And that will be the end of my live demonstration, but I'll drop in the chat our HTML links to directly access the material. Thank you very much.
Thank you, Stefan, for the helpful demonstration. Now we would like to open up for questions and answers or general discussion. Please feel free to add your questions or comments into the Q&A. I see that some folks are using the chat as well. Or please take yourself off mute and speak freely.
Thank you, Sonia. I think I'll start answering some of the questions that we had on the chat. I saw Meredith put in some links. So we had a request or for sharing the recommendations or lessons learned from the countries. We do have final reports from each of the countries. You can reach out to us at EMPHNET. I'll type in my email and we can see how we can communicate some of these results and lessons learned. We will be hopefully publishing most of these lessons learned soon. So you will be hearing or reading more about the experience in the Eastern Mediterranean region through peer-reviewed articles. Also, there was a question about material in Arabic. So the training itself, it is an English training. However, the material, such as the discussion guides, the SOPs, everything is also available in Arabic. And we will, EMPHNET will be hosting this material. And of course, you can reach out to us if you need this material in Arabic. Yes, and as Stefan said, the course on TEPHINET is free of charge, open to anyone, and accessible to whoever is interested to lead the NCAP process as a facilitator in their respective countries or regions.
I think attendees are on mute because of the format of the webinar, but if you like to speak up, please raise your hand or type in your questions in the Q&A box.
Rhonda, sorry, go ahead, Sophie.
I was going to say that we have a couple of questions in the Q&A box that I can read out loud and our panelists can respond to. So the first is from Dr. Saher Shulkaidef, who said, as an HIS person in the machinery of HSS, my question is, how are less resourced systems, especially in health info, to handle all of the assessments and plans that are associated with NCAP? And he did note that at the time that he asked this, he had not yet seen NCAP's methodology and tools or instruments.
If you allow to me address.
That would be great.
Okay, thank you. Thank you, Dr. Sahar, for this question. Actually, you know, we made it clear that the NCAP process actually involves 3 activities. The first one, stakeholder mapping, and the methodology for stakeholder mapping is well established. And we have the available tools that can be used for conducting stakeholder mapping. We have EMPHNET automated tool actually that can be used and has been used in the past. The second activity, which is a SWOT workshop, again, the methodology for this workshop or type of workshops is established. Now for NCAP workshop, you know, based on the stakeholder mapping and the SWOT workshop, this informed the development of discussion guide. And now what I will say now will address another question in the Q&A. In fact, for each country, based on the stakeholder and the SWOT, where we identify a critical NCD areas, each country identify one or more critical areas, and they focus on these areas to find, you know, to develop a plan or to develop a strategy or an action plan. In the NCD workshop, it is simply a discussion guide that is developed, you know, to guide the discussion, where it helps, you know, identify the level of development of a country in that critical area against 6 important public health domains. So either we determine, actually, if you take me to the guide, you know, to the discussion guide, I will really appreciate this. So we have 4 levels, actually. The beginning level, for example, for a strategic direction, we need to determine whether the country is in the beginning level or a progressing level or advanced level. Advanced level means that there is a well-established system to address this critical area, or the last development level, it's leading edge, which means that there is a robust system and the country or stakeholders are employing innovative solutions to solve this problem or to address that critical area. Now, as you notice, and it is clear, the resources are really very minimal. Any country, regardless of resources, it is not resource intensive. Actually, it can be easily done. What simply you need is, you know, expert participants coming together to discuss the critical area and come with a solution. Thank you.
Sonia, if I may add also to what Dr. Youssef is saying, Sahar in the chat is saying, what if the HIS system is weak or there is no data? This is why the NCAP process is unique, because it focuses on what you have. So we're not coming with a very complicated structure. We're coming and telling you, let's assess what you have. And if there is a weak HIS system or the data is poor, then probably the progress level is beginning. So let's see beginning, and let's see what does this country need to move to a progressing level of development. Now, the participants themselves will come up through the discussion with simple plans, simple next steps that they can themselves implement. So they're not supposed to come up with very advanced recommendations. So the recommendations are very, let's say, tailored to the country, because they come up through the country level discussion of the issue at hand.
Yeah, if you allow me also to add, actually, Dr. Sahar, raised a good point. Now he's saying that what if the health information system is weak? In fact, this is an essential NCD area that needs work. So if stakeholders in a country agree that the health system is weak, so they will start the process, develop the discussion guide, and to develop solutions and action plans to improve the health information system.
Thank you very much, Rhonda and Dr. Youssef. We have a few more questions that have come in, and it looks like we have some ongoing questions about how people can access the online training or where they enroll for the course. Stefan, would you be able to give a quick summary? I know you walked through that, but it sounds like we still have some confusion about that.
Of course. So the e-learning is available on our TEPHINET website, and we provided the direct link to it. These are open access, free for anyone to use. There is no sign-in or access restrictions, so there's no enrollment. You simply navigate to the page and click on a link that would allow you to open a new tab, which you'll be able to access each module. There's actually another format, which is a download version for anyone that has bandwidth issues and would like to download and take it with you wherever you may go. There's a sidebar on the e-learning page where you can download and extract the material for you when you are offline. I'm happy to answer any further clarification questions.
And Stefan, to complement that, for all of the materials to actually implement the process, those are also available on the first page that Stefan showed in downloadable format in a zip file. So you can access all of the discussion guides that already are available, all of the workshop forms for each, for the NCAP workshop, and the 4 SOPs that we have. So everything is readily available for anyone to access.
Can I address one question from Yemen? NCD is neglected issue in Yemen. We are totally aware of this, and only at level of Ministry of Health, no accurate data. What first step to start? This is now a critical issue that need to be addressed. There should be, it's the time for action for addressing NCD in Yemen. So now if you implement the NCAP process, see what will happen. The first activity is mapping stakeholder. Now the report from this will actually be a good resource for the country. Now for SWOT, you are basically addressing the gaps and challenges in the, you are identifying the gaps in the NCD area. And again, the report in this, the summary report from this activity will inform also, that will be a good resource for the country. Now, when you come to the last activity, stakeholders come together and, address the issue. If there is a problem with, availability of data, accuracy of data, they can, brainstorm the issue, discuss the issue using a special discussion guide, and then come with a solution. So I don't want to be confused now with the availability of data. In fact, NCAP does not mean solid and sound data to be available in the country. Especially, that you need just, overall basic summary statistics on the burden of the condition, or there is an alarming issue related to the gap that you need to address in NCAP process. So it is really a very flexible, powerful, and unique tool to address NCD critical areas.
Thank you, Dr. Youssef. We do not appear to have any more questions in the Q&A. Oh, but we do have one that just came in the chat. What would be the process to be a facilitator?
So to be a facilitator, the country needs to be interested in conducting the NCAP. And this is where the role of regional public health institute or national public health institute comes. So these institutes can discuss the issue with the ministries of health, see if they are interested in addressing the NCD burden within their country, in conducting the NCAP. And then with the help of the public health institute or the regional public health network, the facilitator can be identified. They can be part of this public health institute, or a consultant who has facilitated previous such high level, let's say, meetings. And that is how the facilitator is identified. Now, once a facilitator is identified, the facilitator needs to undergo the training, which Stefan showcased, to become well-versed in the NCAP and able to lead the country or help the country conduct the process. I would just like to add that it's very important for the Ministry of Health to be interested in working on NCDs and motivated to tackle such issue, because the issue needs to come from them. So they need to come up with what is important. Is it important for me to tackle surveillance? Is it important to me to tackle multi-sectoral action, coalition strengthening? So what specific issue within the NCD realm is important for this country or for this region to tackle? And that is why the Ministry of Health input is extremely important throughout the process. And also there was a question about will the NCAP help specify which disease or which NCD we should focus on? So the NCAP is not really talking about, let's say, diabetes or cancers, or it's an umbrella to cover NCDs as a whole. So how to approach NCDs, how to focus NCDs, on NCDs, because most of the time NCDs within the Ministries of Health are either structured within primary healthcare or within an NCD department. So they are combined as a one unit, and we need to see how to address these diseases altogether.
And Rhonda, if I may complement your response to this question a bit more, I think it's an interesting question in that the NCAP is designed very much to be country-led. So through the SWOT workshop, that's where the country determines what are the biggest priorities or the greatest, the NCD critical area that they would like to address. So it's not specific to diabetes or cancer, as you said, Rhonda. And then based on that, that will be the theme of the NCAP workshop. And so we have various discussion guides that are used during the NCAP workshop. For example, we have general NCD efforts, and that's kind of a catch-all discussion guide that addresses some parts about surveillance, some parts about engagement with people living with NCDs, some parts about impact and what have you within the population. And so it's a discussion guide that can be used in any country that's really just starting or would like to just revamp how they're addressing NCDs and strengthen overall how they'd like to address NCDs. With that said, though, there is a lot of flexibility with the NCAP process. It was designed in that way so that the discussion guides can be used in Jordan, can also be used in Brazil or in Thailand. They can be used in any country, upper income, lower income, middle income, any country with any range of resources. And if through the discussion of the SWOT, there turns out to be a great interest in cancer surveillance and doing surveys and what have you, so that you have stronger data for cancer, The stakeholders can then drive that discussion, and that can be the theme of the NCAP workshop. And so again, it's very flexible. The tools are kind of a template for the stakeholders to really map and design their own discussions and their own planning and assessment that is most important to their own country, and not what we as the developers think are the most important. Does that answer your question, Erin? I hope it does.
Thank you, Rhonda and Meredith. We have a follow-up question from Ariadna, which is, how could I train in London? And I think maybe a broader version of this question is, can the training be done from anywhere in the world?
Yes. So no one's answering the question. Yes, the training is online. It's available wherever you are in the world. So you can train, you have access to the material, you can download all of the SOPs. Maybe you want to focus, let's say, on the stakeholder mapping. So there's a specific SOP for stakeholder mapping. So you have the flexibility to access it from to access the training from wherever you are and access whatever part of the training you want.
Thank you, Rhonda. So currently we don't have any more questions in the Q&A or that I can see in the chat. Oh, we have another question about how to access the training. So we have put the link in a few times, and I think we can put it in again. The training is available at the link on TEPHINET's website, and we'll, I think maybe we can continue to post that, but we can also ensure that that's the last thing that we put in the chat at the end. So if you miss it, we'll make sure that we put it in right at the end. We also have another question. Thank you, Stefan. We have another question. Is there a certificate of participation or completion?
So we do not have any certificate for completion. Since these are e-learnings that are available to everyone, it's hard for us to track who's completed all module 1 through 6. So we've decided not to include any certificate for the NCAP training. Thank you for the question.
Thank you, Stefan. We have another question. Can the NCAP process tools be adapted in the country context? Meredith, I think you were just talking about this a little. Could you maybe elaborate a little bit more on how this could be used in different country contexts?
Sure. Thanks, Sophie. So as mentioned before, the from start to end, the NCAP process is very much country driven. So as you now are potentially thinking about if I should do the course, what benefit is it for me? We really see the conversations with the Ministry of Health happening at this point. So our ministries of health in your countries thinking about better addressing their NCD burden. Are you in a capacity to have those conversations with the Ministry of Health? After that point, ministry signs on board, says they're ready to go. Then you can do the facilitator and recorder trainer and start the activities. And then through the activities, again, these are all country specific. So we have to, or country adaptable. So we have the discussion guides. If there's a word or if there's a concept that doesn't make sense in your setting, those can be adapted. These materials are very much the template of what the NCAP process might be, but in your specific country, they can be adapted. Words can be changed within the discussion guide. As I previously described, if you have stakeholders who are very focused on cancer surveillance, the discussion guide that's based on surveillance can be adapted specifically to that one disease. It's very much driven by the countries themselves and the stakeholders themselves and the Ministry of Health. The Ministry of Health is, as all of my colleagues have reiterated, that was one of our greatest lessons learned from our first pilot in Jordan, that the Ministry of Health must be engaged, involved, and leading each of the, or providing input into each of these activities alongside the facilitator and recorder. So the Ministry of Health can help adapt the discussion guides, adapt the conversations for the assessment and planning so that it better meets the needs of the country itself. Does that answer your question? So basically the NCAP process is and will be adapted to each country.
We have a couple more questions, one in the Q&A. Do you have an example in the training about specific diseases, like for instance, diabetes?
So our training is more provides different scenarios that you may come across within the implementation of the activity. So we do have examples of potential stakeholders who might be best suited to be participants. And so some might be patient advocates from a diabetes organization, or people living with diabetes or living with cancer, and how they might be a valuable stakeholder that can contribute to the process. Otherwise, the training is very much more about how to implement the activities and what situations might come up while you're facilitating or recording. Rhonda, have you experienced in any of the countries in the Eastern Mediterranean an interest for a disease-specific conversation, or has that not come up?
So it actually is very dependent on the stakeholders that are involved. So if you're inviting the, let's say, cardiovascular department, they're interested in that. If you're inviting the cancer unit within the ministry, they're interested in that. So this is where it's very important to choose your participants depending on the issue that you want to focus on as a country. And at the beginning of the workshop, highlight that they need to focus on an issue that is of importance to all of them so that they can work all together under the umbrella of the NCAP. If it's cancer, then let it be cancer. So, but they have to decide that this is of importance to themselves, to them as a country.
Thanks, everyone. It looks like we're about at time. So I'd just like to thank all of our panelists, all of the participants for this rich discussion. And I'd like to turn it over to my colleague Meredith for some concluding remarks.
Great, thank you. And Sonia, I reiterate what you said. I appreciate all of the great engagement and questions from our participants. So as we discussed today, the burden of NCDs is growing, and it's critical that countries develop plans to better address this challenge. This is why we created the NCAP process, which is a tool that countries lead themselves to better assess and plan their next steps. We hope that by making this tool and e-learning publicly available, that more countries will be able to use it. So as we wrap up today, I would like to thank our partners again who have worked tirelessly in the development of these resources over the past 2.5, nearly 3 years. So thank you, my sincere thank you and appreciation to EMPHNET, EMPHNET, and TEPHINET for all of your hard work. And thank you all for your active participation today. I did quickly see that there was a question about TA. We would love to hear if you are implementing the NCAP process in your countries, and we are more than happy to provide assistance and technical recommendations or support to you. And I'm speaking on behalf of EMPHNET, but I'm sure they would also be interested in learning if you are implementing the NCAP process in the Eastern Mediterranean region. So please reach out to us at the email listed here. And thank you again for your contributions, the conversation, and we hope you have a wonderful day. Thank you.
Thank you.